For this body matter today, they tell us about all the drugs that you can get very easily. Effective drugs for different occasion, whether you get headache, whether you dey purge, whether you get pain, whether you dey need to do antibiotics or whatnot, whether you need vitamins and whatnot. But the problem na say some of us, wey we don know the thing say dey work once, we come continue to dey use am gbog. No know say wetin help us once we dey use am take dey scatter our body internal engine.
Now e get some medicines wey people dey drink.
Medicine.
Wey people dey drink anyhow, and you no know say this medicines fit carry wahala put for your body. People dey drink am up and down. I know say many people dey drink diclofenac. They tell you say I get body pain, but people don't even know say diclofenac, if you abuse am, if it give you problem for your life, wey be say you go dey blame your village people.
Really?
Example of the problem. So I go talk some drugs. One problem now, say if it give you ulcer, if you make you dey bleed inside, if you spoil your kidney, if it give you problem with your heart, that one diclofenac own.
Wow. I use diclofenac that year. It's when I get to take away.
The thing be say, yes, the drug dey good, but people they abuse them.
Too much.
They abuse them. So if you dey among the people that abuse medications, open your ear. So diclofenac will give you that problem. Another one again, na ibuprofen. Still on the matter with body pain. If it still give you bleeding, give you ulcer, spoil your kidney, give you heart problem.
Ibuprofen.
Yes.
I use that one too, doctor.
Calm down now. And they talk say people they use them, we they prescribe them, but some they abuse them. That is the word. Waiting, abuse.
Oh.
Another one, if it shock you now vitamin C. Yeah, some people they abuse vitamin C anyhow. You know, say vitamin C if it cause you kidney stone. Yes, vitamin C if increase your risk of you to collect kidney stone.
Oh,
and if you collect kidney stone, or you don't see person will get kidney stone before, ask
how
her how e dey be. Person go make you understand. So vitamin C if increase your risk of you getting kidney stone. So if you dey drink vitamin C anyhow you like, I beg you, give your body a break. Give your body a break. Then another drug again wey people dey abuse there's too plenty. Bicham.
Hey, dog, all the drugs what they use.
Calm down now. I read it today. Bicham, we have Bicham ampiclos. Any small thing will do you. I need ampiclos. Any small thing will do you. I give me antibiotics. And when they make this matter, they very, very surprising. You go hear ladies go talk say, I treat infection. They go. How you go take go when all your body don't sabi all the antibiotics?
Not their customer.
So you don't get resistance. Every medicine, every antibiotics you don't put inside your mouth, you feel collect resistance. So any small thing, I treat infection last month, I treat infection every time you treat infection, my dear, you don't put yourself for one chance. Another medicine where people they abuse again well. Okay, so now ladies now, na postinol.
Hey, whoa, doctor, this table why you want shake?
We'll just scatter the table once now. We'll go create another one.
Once upon a time, when people were the word, this was something that, whether you do or you not do, you go just take am just in case. Make it not be like say something just because they tell us say, if you follow up with man now, you go feed day for like 1 week inside body.
The thing is that you will not talk say drugs bad though. Now the abuse, the misuse of these medications.
Okay.
So many ladies don't get problem with their period because of the postinol with them they abuse.
Don't be lying. That time my period they skip.
I know somebody will tell me say in a month, if you take like, make I not try talk too much. If you take more than 10 postinol in a month. Yes.
What did they do? Which kind of work did they do? And what they take?
I dey tell you life matter.
You know how to gauge am.
See, I dey tell you serious matter. And then they like that plenty. Another one we still dey na paracetamol. If it spoil your liver.
No, but doctor, it does for everything.
I come this morning.
And they take paracetamol in advance before they call the office. And they say, headache. Before the headache will come, make I just meet you for frog. But doctor,
I dey tell you serious matter.
These are regular drugs that you can see in regular places.
That is why there's a problem.
No. Why do we not they see all these things that they put us say be aware? Why they make awareness more?
Before marriage they buy and people for marriage know this thing.
That's the point.
People for marriage don't know this one. All the things they don't say now take, go drink, mix body pain for you, mix body pain. And all the mixing of the body pain, they knock your liver, they knock your kidney.
They scatter your engine for
Next
your body.
thing you go say my leg they swell up, eye they swell up, problem, dialysis. Do you
Lagos.
understand? So all these things dey na make we dey come shout. No, say before doctors no too dey talk, but right now we wan come let people know. Tetracycline, most especially woman wey get belle. You see for our society, everybody na doctor. Everybody know everything about medicine.
Because he work for you, come prescribe for the other person.
Come carry now drink. No, say as you dey drink that tetracycline, e go affect your pikin for belle. E go affect the pikin bone. E go affect the pikin teeth. So be say when the pikin come dey grow up, the teeth go color. You don't see people wey get colored teeth.
I say na natural.
People wey get colored teeth. One case be say when the woman get belle, some of these women they take tetracycline and some other of the brother and sister of that medication, or when the pikin small, they give am that medicine, and they don't know say e dey bad. Then another one before we go to the phone line sharp na flagyl. Everybody they take flagyl. Any small thing flagyl at the purge. You don't know whether the cause of your purging na inflammatory bowel syndrome, whether the cause of your purging na osmotic. You don't know. Every little thing, as you just purge, give me flagyl, give me yellow capsule. Very bad. Very bad. Very bad.
Una don hear am o. In fact, one of our sisters said from Obodo Yibo for United States, he say, good morning, doctor here for America. Make I tell you, this thing. So most of the drug for here, they contain that they call acetaminophen.
Acetaminophen, that's paracetamol.
That's not paracetamol,
Yeah.
especially the pain reliever ones.
Yeah.
And say that thing alone, they constitute nuisance when it comes to kidney. So they gauge am for the table prescribe paracetamol for here.
They
gauge am.
Correct.
So why would not they gauge our one for here?
That answer, you get people wey the question fit them. No be people like me. Nine get that question. You get people wey supposed to answer that one.
Okay. If you get question, when you want ask doctor, if you get observation, if you get testimony, yes, we like testifiers too.
Yes.
When we say you don't take a drug and you not know say that drug might be the
almost
problem. Your leg swell up.
He almost spoof you.
You almost knock you akpako until you can understand. Say, oh, but it be like say I need to change my ways. Please come to the Cathedral of Body Matter and come and testify to wetin doctor dey talk, and now it makes sense for you or not.
Dr. Fred, good morning.
Good morning.
Yes. Like what you dey talk now, like for like 2 years now, I know they sleep well. So they come there, I go hospital, they will give me sleeping pills. You know, so the thing not going to work for me again, so I don't know what to do now.
Chai, sorry. And I don't believe say maybe your doctor will give you sleeping pills for a very long time.
Supposed to be short term.
Because now short term go give you sleeping pills, take them few days. But sometimes some people, because say you work that beginning, they come they take them the month, they take them the month. Very soon it not go work again for your body. So the best advice right now be say you go leave the medicine. Because if you continue, as they enter old age, sleep go on leave you. Your eyes go dey open without taking the medication.
For old age,
yeah, so you go just the open eye.
Person supposed to crash and
just rest. So now small.
Maybe that they make some for daddy and mommy they quit they sleep because they don't take too much medicine when
all
they small.
All of them get sleeping medicine for house now. Any small thing, I know they sleep. Give me medicine, make I drink.
If you say the amount of drugs,
as you they drink them, your body they get dependent on them. They get dependent. True. One day, you no go fit sleep without taking that medicine.
This vitamin C, name I want to talk about.
Okay.
The vitamin C, it improves our system. So coronavirus come out and system. People they use them where we use them.
Yes.
I call they use they cause kidney testing again for us. Never time one ask.
Okay.
How vitamin C they cause kidney problem? Oh yeah.
We no
Good
talk
question.
say vitamin C bad though. We talk say people wey dey use am for too long. Hope you know, even water, e get as you go drink water too much, you go enter one chance, water fit give you problem. Wetin we dey call water intoxication. Does that mean that water is now bad, make you no drink water again? I no talk so. Na so vitamin C be. Yes, people take vitamin C, oh, I want to look fresh, I like my immune system and the rest. But if you take am too much, we don find out say e dey cause kidney stone. So as you dey hear me right now, if you don't take am for a very long time, abeg stop, give your body a break, leave your body alone, let your body enjoy itself. Later you can go back.
Okay. Somebody say abeg talk about augmentin. Small kata mommies don give their pikin augmentin kpakpo. E no dey break down pikin system.
Augmentin is one antibiotic wey be say we dey pray and we dey beg make people we no get resistance. It's a very very powerful antibiotic, and any small thing wey do people, they don't go take augmentin.
No be lie you.
And most of this kata, most of this thing sneezing, na virus they cause am, no be bacteria. So if you take all the antibiotics for the world, e no dey work. The virus your body go deal with am, later e go. But any small thing augmenting. Shey we know say resistance of most antibiotics dey around though, and if you get resistance, you go pay money well to buy the most expensive antibiotics. So I beg you, if you no get need of antibiotics, no touch am.
No touch am o. As e dey so, this one come to you say abeg o doctor good morning, me wey dey also dey take folic acid and vitamin B complex, in fact na my everyday drug, ogechi for kotu, wetin I go do?
Ogechi, yes, very good. Number one, if you dey prepare to get belle, very wonderful. But aunty, if you no get any problem, you no get problem with your blood volume, your PCV dey normal, you no dey anemic, you no dey pale, leave am alone. Take your fruits, e go help you.
Okay, this one come say how many times I suppose to take Postinor for a month? Because me I dey take am like say I dey chop food o, my sister. Doctor, ask me.
I no wan do that deliberately for Postinor. I no wan talk say take it once in a month, but you should take Postinor highest once in your cycle, once in your menstrual cycle. So if your menstrual cycle na 35 days or na 21 days or na 28 days,
doctor,
take Postinor once in the menstrual cycle.
A person could be Nakamura and Dr. Atkinson 5 times a day, keep the code away.
That discussion will take it to social media.
We'll go social media. Okay, for those of that one I mentioned, you maybe take Postinor and all those kind anti-belle drug into. Make una go for inside Dr. Fredo Star in social media for Instagram and TikTok. Una go see and there. This was say my own say this augmented drug he show me I get am chap due to body weight. This show me I get am wait I get to drop am sharp because they make me the fat.
No be augmenting. You get one medicine where ladies they take. Said I want add weight. If you want add weight,
drop am in 20 seconds.
They go say they call them steroid, corticosteroid, mau. If you take mau, problem there, I beg you. If it scatter your life, pass all the whole medicine where I don't talk since.
Just over.
Yeah.
Okay.